Hi Warriors, it's Unit 9, Lesson 13, the last one. This is about therapy. Still, we're talking about the type of therapy that involves the medical community. You're going to fill out this chart with this one, and it goes a little bit out of order, but it's not a big deal. We'll work together. First, we start with psychosurgery. Psychosurgery, when treating disorders, thank the Lord, lobotomies are no longer a thing. What a lobotomy was used in the 1930s and 40s, is when they took like an ice pick type deal, kind of looks like a screwdriver, poked it through the eye socket, stirred it around a little bit, and then severed neural networks and connections in our prefrontal cortex. If you remember anything about your prefrontal cortex, it's where the magic happens. It's what makes humans human. And by doing so, they turned regular, ordinary people with some oddities and quirks, maybe they're schizophrenic, maybe they have bipolar disorder and depression, turn those people into uninterested, uncreative, and childlike personalities. So they were absolutely no good. They were used for a 20-year span in medical community, but thankfully no longer anymore. I'll tell you a story about it in class. Here is a clip from a movie of a man endorsing it.
The eyelid, breaking through the bone, pressing it up into the prefrontal lobe, manipulating it so as to sever the nervous connections.
It's pretty awful. Another biological approach when it comes to using, medicine to treat disorders includes electroconvulsive therapy, also known as ECT. These are prescribed for major depression, and it's kind of a last resort when antidepressants don't work, when other treatments don't work, like cognitive behavioral therapy. So as a last resort, what happens is the patient is kind of put to sleep, and then they pass this electrical current through the brain. It causes a seizure, and when the folks wake up, they have temporary confusion, of course, and memory loss because they were just knocked out. But it's known to work. It's been improving depression. So here's another shot. Watch it in class. Drug therapy. So using drugs to treat disorders works for 4 types of drugs for aiding the symptoms of any disorder. And your anti-anxiety medications, of course, that's going to be used to treat anxiety. So you're talking about PTSD, OCD, GAD, any anxiety disorders. What it does is it depresses the nervous system. Now, what do we mean by that? Those things that are overactive, that overthinking type of thing, that gets calmed down a bit, but it can lead to some side effects like drowsiness, tiredness, and dependence. A drug like Xanax, Valium, those are addictive. So we have to be careful about how those are used and prescribed. Antidepressants their goal is to increase the amount of noradrenaline and serotonin in our body because they block the reuptake of serotonin. Next slide, I'll show you. So examples include Zoloft, Paxil, and Prozac. They are not as effective in less severe depression, but they do have some significant side effects. They may increase in appetite, and so people may gain weight due to it. Hypertension, heart problems, maybe dizzy spells can cause maybe some lightheadedness. How they work is like this. So you remember this neural network connection and the things that are jumping across the synapse there are the neurotransmitters. So if you pretend that is serotonin, the receiving neuron will shut off when it's had enough. And then the sending neuron is supposed to suck back up the serotonin that got released. Well, with a SSRI, a serotonin reuptake inhibitor, they don't take it back up. So the neurotransmitter stays in the body and gives us the good feeling stuff when we need it. Antipsychotic drugs include prescribed for things like, schizophrenia. A psychotic is meant to stop delusions and hallucinations. It blocks dopamine activity in the brain because schizophrenia is linked to overactive dopamine. These types of drugs include Thorazine, Risperdal, can cause sluggishness, tremors, and twitches. It's the reason why guys like John Nash are not necessarily on board with treating their illnesses with drugs, because sluggishness. If my brain is the beautiful mind that I'm depending on for everything that I do for my welfare, I don't want to slow it down. And that's kind of the problem behind antipsychotic medications. They do make people a little slower. A biological approach including mood-stabilizing drugs includes lithium, which is prescribed for things like bipolar. And if you remember me drawing on the board the ups and downs and the set points of our emotions, it kind of makes that a little bit more flatline. So flattens the cycles of mania and depression, and makes the distance between the highs and lows smaller. Can lead to memory loss, shakiness. Now, lastly, there's, like I said in the notes, there's just a good old-fashioned lifestyle change. There are some connections to the things that we put into our body on a regular basis, like sugar consumption and the risk of depression and schizophrenia. Sugar is treated in our body a lot of times like an illicit drug, like cocaine, and we get addicted to it. So if we consume a little bit of sugar, we come down in a crash. But let's talk about aerobic exercise and how it can help improve mild to moderate depression. Aerobic activity comes with the release of endorphins and good-feeling drugs in our body, natural drugs, neurotransmitters. When we have a regular sleep cycle, believe it or not, that is enough to fight off some of the mood disorders and anxiety disorders. It's not always as easy as just saying, okay, I'm going to get a good night's sleep tonight, because anxiety is anxiety, and it can wake you up in the middle of the night, and then what do? You have to have some strategies like active, progressive relaxation, a healthy diet. Foods today are scary, so you just got to make good choices about what you put into your body. Try not to eat things that come from a bag, from a box, and you might feel better. But that's a different story for another time. Here you have a little graph, percent of patients in each 6 months after treatment. You can see that adding exercise into their daily living makes a pretty good path to recovery.